is that she is 33 years old. Her AMH is 2.2 picomole liters. Her AFC is 12 to 15, and she can't produce high-grade embryos. Would you recommend that Ruby has the endometriosis surgery?
Okay, so here we have got one specific problem. Here the AFC is high, or high, much higher than AMH. What's her AFC?
Her AFC is between 12 to 15.
Her age, what's her age?
33.
That's right, yeah. So AFC is higher, still low for her age. Is okay. So in median AMH and AFC for her age should be AMH should be approximately 20-25, and AFC should be 25-30. That's median. So her AFC is fairly low for her age, but especially her AMH is low, 2.3 picomole liters. Yeah.
Yes.
So here it looks generally when you measure AMH in picomole liters. If you're in US and some clinics where you measure AMH in NGML, you need to multiply it by a 7.14. So to convert it to picomole liters. So if you measure AMH in picomole liters, that should be very close to AFC levels. For her, generally with this AFC, you would expect AMH should have been approximately 10-12. So if you have 10-12 antral follicles, which is producing only 2.5 or 2.3 picomole liters of AMH, that indicates each follicle producing less amount of AMH, maybe 2-3 times less amount of AMH. So why is that? Very likely she has a AMH gene deficiency or AMH receptor deficiency. Usually that comes together with deficiency of other receptors like FSH the receptors and LH receptors. Usually the patients with a receptor deficiency have problem with the maturation of the eggs. For her age, it's very unlikely she has a poor quality eggs. At the age of 30, 33, very likely her egg quality is good, but very likely the issue is related with poor maturation of eggs. So you need to improve the maturation of eggs in IVF. You do that by doing certain things. For example, you need to use broadband FSH, or you need to use FSH with additional high dose LH like Luveris, or you need to use a broadband FSH, which is Menopur, for example. So to activate multiple receptors of FSH. So this is one thing. Second thing is you need to give a high dose of FSH. So normal dose of FSH for her age, for example, should be approximately 225. But threshold for FSH may be very high because activation of the follicles may take much higher dose of FSH. You can give maybe 450 units of FSH to activate more follicles and get those follicles into growth stage. Second is you may need to do longer stimulation. If you have a problem with FSH and LH receptors, you may need to take follicles much bigger size before you give the trigger. So then third thing is you may need to use a much more broadband trigger and much higher dose of trigger like Prignal, Choreomon, and much higher dose, 10,000 units of trigger. Why? Because Choreomon, for example, very broadband trigger, and it activates multiple receptors. So it's got multiple more amino acids than recombinant trigger like Ovidrol. So and also you may need to use a much higher dose of trigger like 10,000. Why? Because triggering LH threshold, receptor threshold for the trigger may be much higher. So 7,500, 5,000, maybe too little dose. You may need to give 10,000. So you may need to consider doing dual trigger using Choreomon plus decapeptyl, Ovidrol plus decapeptyl. Why? Because here you use one artificial trigger, which is Ovidrol or Choreomon or Prignal, and also natural trigger, which is decapeptyl. A natural trigger may match her own receptors. So here receptor is like lock and trigger is like key. So if you use a natural trigger in addition, it may actually open the on lock, because on lock and key may match genetically. So you need to also, if doesn't work, then another type of regime you may need to use called flare regime. Why? In flare regime, you search the LH and FSH into bloodstream, and that can activate the follicles and bind to natural LH and FSH, can bind to receptors of the follicles and may activate the follicles and may improve the maturation. Here, very much we are talking about improving of maturation of the eggs that can improve the quality of the eggs and can create multiple, hopefully, high-grade embryos. So endometriosis here is just distraction. Yeah, so endometriosis does not cause this FSH and AMH and AFC mismatch, and the endometriosis, unless it's on the ovaries with chocolate cysts, has a very little impact to egg resolve, and it doesn't really affect egg quality. So yes, endometriosis treatment may be necessary for different reasons, like if it's severe endometriosis, if there's a repeated implantation failure, if it's causing problem is access to ovaries. But here there's a sign of specific problem, mismatch of AMH and AFC in low egg resolve, and the poor embryo development. So which means here issue is a low egg resolve and very likely receptor issue, AMH gene deficiency, AMH FSH LH receptor deficiency, and which is very likely leading to poor maturation.